Welcome back to a mini rewind report.
So today we're going to be talking about TikTok trends because as aesthetic providers, sometimes we cringe at the things we see on TikTok.
Or hear about, or get shown.
Yeah, and then sometimes we're like, oh, well, should we look into that?
Yeah.
Sometimes they're okay. So
Or sometimes we're already doing them, and I'm like,
Yeah.
oh yeah, I've been doing that, girl.
Yeah.
Yeah, so let's go through a couple of them.
Yeah.
And this is going to be fast because, of course, you guys know us. We can chit-chat, especially this one.
I know, I'll talk for hours.
okay, first one is slugging with Aquaphor.
No.
Yeah, I say no.
No.
There's so many
One
better.
exception though, post CO2 laser.
Oh, well, then
Yeah,
you have
post
to.
CO2 laser, you want to stay covered and have an occlusive and be moisturized, but you don't need to slug every night. Not with Aquaphor. It's very clogging.
It's
Occlusive, yeah.
Really
You don't
inclusive.
breathe. Yeah, just put some decent moisturizer on.
Go
on
look
top
at
of
our
your
last
serums.
podcast, or our first podcast.
Yeah,
We talk about
listen
some
to
good
the first
moisturizers.
one.
Yeah.
Okay, what about beef tallow?
No, that makes me gross out. That's really gross.
Yeah, I'm gonna say no.
I mean, I know a lot of people really love it, but no, I just picture my dogs licking me.
I
don't
just
know
think like maybe that worked in ancient times because they didn't have skincare. So
why.
They couldn't get, well, I guess they could probably figure out how to get beef tallow back then. Yeah.
well, I think back then they
You
would
just-
hunt and utilize the entire animal.
Yeah.
So
know that
we don't need to do that today. It's unneeded.
Okay, I have a crazy one, and this, I'm outing myself a little here. I have the new addiction to Facebook Marketplace.
Oh, yeah.
So we've been redecorating our apartment. So like literally every hour, I'm like looking at Facebook Marketplace. And I think because of the profession that I'm in, I get some things pop up, and it's like lip filler pens. So like injection free. The pen like sticks in your lips and fills your lips with filler.
Just by pressure, I think.
Yeah, but for
I've seen this. I've seen
$150.
this.
I can't even imagine.
And like these pictures are crazy. It's like no shape to the lips whatsoever, just blown up, almost like anaphylactic reaction looking.
People do
So I'm not giving you guys a chance to even answer this because I'm already like,
No.
I just
It
have
is
to
crazy.
say,
It's on
please,
Marketplace.
PSA, there's such a big safety issue with that. You have arteries in your lip that come decently superficial, and if you're going to let some chicken or garage shove a pen or have a pen that
how many
shoves filler.
opportunities can you hit an artery with like one pen with a bunch of needles?
Also,
Absolutely
I mean,
not.
Imagine the pressure.
Yeah. Oh
The-
yeah.
The thing is, they want to do it themselves.
Yeah.
right? Not in a garage.
Yeah, like a
They
pressure
wanna do it-
occlusion.
It's a do-it-yourself.
Yeah,
lip
please.
No,
don't
they're
do it.
they're selling it. They're selling it on Marketplace and
you
having
can
people
buy
come to
it.
them and then they do it to people.
Oh no.
Yeah.
Obviously
I mean,
not
either
licensed.
way,
Yeah.
I mean, I'm
Crazy.
sure you can buy the pen if unlicensed people
On
have
TikTok
the
Shop,
pen.
probably,
yeah,
yeah.
please don't. Please don't. No.
Okay. Here's another one. Face tape, like at bedtime.
I don't think it
I mean,
works.
it can't hurt you, but that's.
I'm gonna be honest. I've actually seen a patient who looked really fantastic after like 8 months of no Botox, and I'm like, wow, it lasted a really long time. And she was like, I've been using face tape. I'm like,
So I've only seen a couple.
Maybe it's just her, I don't know.
Actually, injectors show like my bedtime routine, and they tape. There's one around the mouth, right? So
This
they're-
is more like it tapes
breathing.
your entire forehead.
So
And
it doesn't
you put
move.
tape on like your nasolabial folds, and you put tape on your jaw. It's a different tape than the breathing tape.
yeah. But
but
how much
it
are you
can't
moving your
hurt
muscles
you.
during
I
the
just
night?
think, how much are you paying for this tape, and you have to apply it every night? I mean,
You better be single. Can you imagine?
yeah, our Botox is only
Rolling over
$14 a
being like,
unit, and you
"Hello."
come in and you don't need to tape your face every night. That's
Yeah.
my opinion.
Yeah. I'll say it can't hurt. I don't think it's that effective.
No.
Yeah, it can't hurt.
But it's not as bad as some of
dangerous.
these other ones that we've mentioned.
No, if you want to tape your face at night, sure. I don't want tape on my face when I go to sleep.
It's
Yeah.
also an occlusive.
Yeah.
Yeah.
I don't know.
What about castor oil for like hair growth?
I do use it.
Does it work
Very
well?
strange. I don't know because I forget it a lot.
Yeah, I've actually been thinking about trying it.
always
Not gonna
forget
lie,
to
'cause
do
I would
it.
like I used to use those like Grande Lash or Babe Lash, but then all those things came out about you losing volume under your eyes or,
Or
like
the color of your
changing
eye.
the color. So I'm like,
Yeah.
I'm not doing that anymore, and now I feel like my lashes are kind of suffering.
I think, again, it's one of the things where, like, I don't really think it works, but
Probably not.
it can't hurt.
I
So
was
if you
thinking
I'm
want,
gonna try it. I'll
eyebrows.
report back in a couple.
I have
really
super
sticky.
sensitive eyes, so I don't want to oil on my eyelid.
It's very sticky, and I put it on with like a little eyelash brush, the disposable ones. But I've only done it. I mean, I always forget. 'Cause I'm
Castor
so
oil
tired.
in your belly button. I'm so sorry. Just please stop.
Or on your
Please
liver.
stop.
They sell castor oil liver
Oh my
cushions.
gosh, you guys.
I don't understand.
I don't think so.
Okay, what about lip blushing?
I think
I'm
it
a
looks
no.
so pretty, but
I don't like it.
I don't like it either. I think like the theory of like you're creating this pretty shape on your lip. I mean,
But it's not really your lip. It's the
it's
tattoos
not
on
your lip,
top of your
and
lip.
long-term damage. Your lip peels. Like how many times, like your lips peel. We put chapstick on.
And the color
You bite your
changes.
I
lip.
think it's,
It
like,
fades. When it fades all
similar to microblading your
uneven.
eyebrows.
Yeah, microblading. When you microblade your eyebrows, yeah, it looks fantastic at first for some people. I mean, if you go to the
The
right
amount
person.
of tattoo removals I've had to do for microbladed eyebrows.
That's what
I
I'm
would
saying.
never- I
That's
would
what I'm
never.
saying. It was a huge trend. Then they faded all weird. Now people walk around and they have these orange tinted
Yeah, I have people with
eyebrows.
blue ones,
Or like
orange
blue, I was
ones.
gonna
They
say, I've
change.
seen
Blue,
blue,
the lips, I just wouldn't mess with it. It's such delicate tissue. Just buy a really good lip stain
Oh, you
and
can buy lip stain. now.
lip liner,
Yeah.
and don't damage your lips.
What
Sorry.
about like Korean skincare that people are getting on TikTok, or like the PDRN salmon DNA or sperm trend?
I mean, Korean skincare. It depends on the brand, right?
We've had some from
I'd say most of the
Korea.
time it's pretty good.
Most of the
though.
time, it's great.
A
Yeah,
doctor that I work
I
with
use
brings
Medicube.
it back from Korea when I watch his animals, and it's really nice. Just the warning is just make sure it's really truly made in Korea or made by a Korean company, because a lot of them say that, but they're actually made.
K Beauty. It's a marketing scheme now.
Because people know that if they put Korean on the box, people are going to jump for it because they have great companies out there and they have great product. But
Yeah.
is it really?
Same with PDRN. I mean, we know PDRN you can only get in specific percentages within a product, and so I don't know if it's marketed as PDRN.
Sure,
Yeah,
it's authentic.
I don't think
But
it's
it's not
I
gonna
don't think it's
hurt.
harmful. It may not be worth your money.
Try
but-
Medicube.
Yeah.
I'm not even affiliated. I just really like it.
She loves Medicube, yeah.
Yeah.
Okay, I know what you guys are gonna say to these two, so I'm gonna, jump straight into it and ask why you
Okay.
feel the way you
I
feel.
can't wait.
But at-home microneedling, like with the doctor pen, and at-home Botox,
No and no.
because we've seen this on TikTok. I mean, people
Yeah.
are really injecting their own foreheads and stuff. I mean, geez, we don't even inject our own foreheads.
No. would
Yeah,
never.
I mean, with the microneedling, I know it seems like a simple procedure, but unfortunately, a lot can go wrong. And
Yeah.
sterility is,
Sterility,
is
yeah.
important. What you're actually microneedling into your skin is a huge factor. Where these things come from, do you know that the needles are sterile? I just
Well, yeah, what
why
I like
would you do
to
that?
say is the pens that we
No.
buy, you have to have a medical director, a doctor's license to buy these pens.
Yeah.
And those companies are held to a certain standard because they're medical grade.
Yes.
They would be in a lot of trouble if we found out that those are not sterile needle tips.
Oh my
But these
gosh,
needle tips
I
on
can't.
Amazon or TikTok shop, maybe they're sterile, but maybe they're not. Who's going to hold them accountable?
Right.
Yeah, and you're doing it yourself. People at home that are doing it, do you know like the different layers of the dermis? Do you know like why you're at this depth, or did you just watch a TikTok
What are
video?
you
could cause
cleaning your
scarring.
face with
You could
first?
cause
Pigmentation.
pigmentation.
Yeah,
pH.
acne. That's why we have Dr. Creamy as our medical director, and we use his pen and sterile. All of our needles come in single serving packages, so when we break the seal, it's usually at the bedside, and then we use it right
And we
away.
don't do any reusing needles, no cleaning
No.
and reusing for the same patient. We do
No.
not do any of that. It's a fresh needle
Yeah.
from the individual
Package,
packet every
yeah.
time.
All the serums put on are medical grade,
FDA.
FDA sterile as well. You're double cleansed, you're pierced, it's just, please don't do it at home.
Yeah, and the home Botox.
Some may
I
call us a
mean,
little too by the book, but
Yeah.
that's what we are.
kind
So
of boring. We're
sorry.
very
Yeah.
law-abiding
We do we do
citizens
things
over
the way
here.
we're supposed to. We take the safety precautions. We pay a little extra if that's what we have to do.
Yeah.
And if there's
Or we
something out
say
there
no.
that's like crazy
Or we
and
say no
new,
sometimes.
we let other people try it and then it gets tested. We're not going to do something to our patients that there haven't been clinical
It's not
studies.
worth it. No,
Yeah.
I think they appreciate that.
Yeah.
'Cause
Yeah.
They know when they come here, they're going to get type A treatment by the book.
Yeah.
safe. Yeah.
So to wrap it up on that note, I'm going to throw this out there, and you probably have all heard about it once, PDGF.
Oh, no. Not in your face. Yeah, no.
PDGF, if you guys don't know, is a platelet-derived growth factor, and it has remarkable, capabilities behind it. But in the field of aesthetics, there's so much unknown about it. It's actually only FDA approved to be used in like orthopedic surgery, and there's only 2 surgeries and 2 places in the body where it's been studied and approved to be placed to regenerate.
Wait, can we back up and tell people why someone would get this procedure?
PDGF?
Yeah, why are people doing it? Basically, it creates volume. So
It creates volume, but what in the orthopedic studies that it's actually approved for, what they found is this is a growth factor. Now, when it's placed in your body, what it grows, what it's communicating with is kind of unknown still. So it can regrow vessels, it can grow fat, bone. So placing this in something like your tear trough under your eye,
very thin tissue.
tissue. 1, you don't know what it's going to grow. 2, you don't know when it's going to stop growing. And
There's
3,
no way to control it. There's no control.
we don't have any protocol in aesthetics for any adverse effect, things that arise. So if something goes wrong and you have a nodule or a lump, there's nothing
Pretty
yet.
tall, yeah.
There's nothing yet in aesthetics and publication that tells us who put it there what to do to help you. So that's why here at Rewind we're not doing it.
Yeah,
just
I mean,
yet.
it sounds great. It sounds exciting, but we're not going to do anything that's new and hasn't been tested.
And it's not. It says not for injection. And I mean,
Yeah,
when I
as
used
soon
to
as it
do-
is, we'll do it. But
Yeah, when I used to do orthopedic surgeries in the OR, I would watch them inject it directly into bone.
Not from this specific company, but actually platelet-derived growth factors
or
from.
diabetic foot ulcers.
it's like the
because-
generic name versus the trade name, right?
Right.
Yeah.
The generic is PDGF.
Yeah.
Could have amazing potential use. I think if it's
Eventually.
if it's going to be FDA approved for injection in the face, my bets are placed that it's
I'm
for
excited
something like
about
the
it
jawline.
once it's safe. I'm excited about it once we know it's safe.
Yeah.
But I don't want to do anything that's not safe.
And once there's a solution, if it goes awry, we don't
Yeah.
even have protocols.
Speaking of not necessarily unsafe, but non-FDA approved, what do we think about injecting exosomes?
No.
We're boring over here. We don't do scary.
But we can do them
risky
topically. We can
things.
microneedle them. We can put them
Yeah.
on post lasers. And
The
there have
problem,
been
let me just say really quick, the problem with injecting exosomes is exosomes are derived from humans, most of them. If it's a good company, it's what it should be from.
adipose tissue, umbilical tissue. Some are like synthetic.
Placenta.
Yeah.
Some are foreskin. I mean, these things come from everywhere. But it's from another human. So if you inject it, we all worked in the hospital, ICU. She does anesthesia, did do some ICU, ER. I mean, we have extensive experience on this couch. When you inject a blood product that's not your own from another human, there is so much, oops, I touched the mic. There's so many, pre-protocols to follow before, I mean, there's, if you put a blood bag that maybe is, it's the same blood type, but it takes double nurses to do that in a hospital. And there's people out here just injecting, a blood-derived product or something derived from another human into your face.
DNA-derived product from another human.
So many bad things can arise.
Yeah, and hey, maybe it gives you good results, but we don't know what those results are going to look like later, and we don't know the potential complications of those results.
Yeah,
So-
it's risk versus benefit, which
Yeah.
should be
And this is all elective.
medicine at all the time.
Yeah.
And
You can
evidence-based
microneedle
practice.
it and get just as great.
Yeah, I mean,
microneedle it.
we're not in the ICU anymore where it's like, hey, the patient might be dying. Do we try it? Do we not? I mean, this is
Right.
completely elective. People come in because they want to enhance their aesthetic appearance. So we're not going to do anything that's potentially dangerous
No.
at the risk. It just doesn't make sense.
No.
So we'll get behind it, once it's studied properly.
Yes.
Yeah, and exosomes is like a whole topic for itself.
Yeah, we can have another.
Yeah.
Most of you probably don't even know what that is. So we'll have another
Yes.
Yeah.
podcast on that.
Yeah. Well, on that note, watch your TikTok. Hey, follow us. We're on there.
If you have any questions, send it to us.
Yeah.
If you
Yeah.
have any weird TikToks that you come across, let us know, and
Yeah.
we can tell you what we think.
But always ask your provider or who you see before you jump on one of these TikTok trends.
Yes, please do
Yeah.
that. Yeah.
Signing out.
Signing out.
Bye, guys.